Hey there, I'm Phoebe Walker, and today I'm here to talk about post-surgical clips. 8 years ago, I had a double mastectomy and reconstruction, and when I had it done, they moved butt tissue to the front. And my doctors at the time told me that they were going to be using clips to hold them in place, because if they did not, then I would end up having breast or boobs in my tummy. And I was like, okay, yeah, I don't need boobs in my belly, so I let them do that. However, they never explained to me how to manage the clips after surgery. And I was very afraid to rub them out, massage them out, touch them for fear that I might break something loose and end up with boobs in my belly. So I didn't do anything. And then several years later, I started having deep pain all the way up to where I could not lift a shirt off over my head without issues because of all of the pulling and tugging in these areas that had become very tight. And I needed help at this point. I was almost in tears. I went online to look up a Google search to see if other people suffered from post-surgical clips, because I assumed that it was the post-surgical clips, because every time I touched the boogers, they hurt like heck. So I did that search and found actually quite a few people didn't even know that they had post-surgical clips, let alone how to care for those post-surgical clips. So first of all, shame on the doctors for not telling patients that they had them. And I'm going to go a step further and say shame on the doctors for not telling patients how to manage post-surgical clips. Now, I'm going to move forward and tell you how I manage mine. I am not a doctor. I am not a medical staff member. However, many years ago, I had experience in the medical field. All of what I'm going to tell you is just something that I have picked up from other people and I have implemented and found some relief from. My heart significantly goes out to everyone who has pain. Unfortunately, I don't have any suggestions for people who have deeper surgical clips. This is more for the ones that are more on the surface, that you can actually feel right under your skin. As far as the deeper ones, I would suggest talk to your doctor. Maybe ultrasound would be a good opportunity to relieve some pain for you. As for me, because I have multiple sclerosis, I have a fantastic network of care providers, chiropractic, acupuncture, massage therapy, and even at the gym, I work yoga. And recently, this year, I found a yoga called Yin Yoga that does 5-minute holds on poses, which is a really deep stretch. And I have found that that has really been helping to break loose a lot of the scar tissue from my muscle tissue, making movement easier. Now, for the pain that comes with my post-surgical clips, and I have 8 of them. I have 2 here, 2 in this area, and I don't know if you can see it, 2 in this area, and 2 this area, 2 this area. These ones are probably the worst ones because they're right along my sternum. But for the pain that I've received there, my massage therapist has suggested that I massage them, and I have been doing that. And I do want to caution you, when I first started massaging, I said, yay, I can get this out, just let me get at it. And I just really started rubbing hard, and you don't want to do that because I was sore for probably about a week. I think I probably almost bruised myself. But my massage therapist suggested rubbing with and against the muscle grains, or the fat tissue grains where the scar tissue is built up. Because when you rub against and with, then you're breaking it loose and then pushing it away. I suggest doing a nice gentle massage up and down like that, but probably do it when you're in the bathtub or the shower, because then you have soap on your hands and it'll glide real easy over the top and it won't really hurt so bad. If you find yourself pushing so hard that it hurts, you probably need to not do it. Again, I suggest you talk to your doctor and ask them about these things. There's no reason why any medical person shouldn't suggest to you how to manage scar tissue, because that's what this is. And I like to believe that at the point in which you get it all broken up, you shouldn't have to worry about it coming back again. So here I am, about, 4 months outside of starting my yin yoga, and I'm already starting to feel a lot of relief. When pain was really, really bad, I did go get the ultrasound at my chiropractor's office. He let me come in for some ultrasound treatment, and that really helped the initial stages of breaking up the scar tissue to help me be able to get in and start massaging because it was just too painful to touch. So anyway, please, again, don't take me as a medical person. I'm not. Take me as your friend next door who suffers with something very similar to you. And I hope in some way that this helps you. If you have other suggestions you'd like to share, I would love to hear them. So please post it below. Thank you so much. Have a good day. Cheers. Bye-bye for now.